Okay, welcome to another video. I received a comment from one of my videos. It was a video about Andrew Tate. And someone told me in a comment that Andrew Tate isn't British. So, it's my bad. I was kind of ignorant on that. And I saw that I got some dislikes on that video. So, no harm done, you know. So I gotta be a little more careful. I gotta do a little more research. But my disability won't be an excuse. So I gotta just take it like a grain of salt and just move on. So I apologize to everyone who viewed that video. I also like to apologize to people in the UK. So, I didn't know. I was reading and I said the wrong thing. So Andrew Tate isn't British. He was born in the US and he moved to the UK. So, I'm just going to say that. So I'm wrong on that. So, hey, you can correct me again. So, no harm done. Okay, in this video, speaking of the UK or the United Kingdom of Great Britain and Northern Ireland, I'm going to be reading something about the NHS, the National Health Service, the Universal Healthcare System in the United Kingdom. Okay, and it's going through a crisis. So I found something on The Guardian. I'm going to be reading about the NHS in the UK. And in this article on The Guardian, it's titled, "This NHS crisis is historic. A war footing is the only way to deal with it," by Simon Jenkins. Okay, and it reads as follows, the beginning of this. "The situation is now as bad as it was in the pandemic. What's needed is the parliamentary coalition to confront the chaos." It reads as follows: The gap between order and chaos is narrow. Simenon patient waits 99 hours for a hospital bed. Groton woman lies screaming for 25 hours for an ambulance to arrive. Oh my God. It is said 500 people a week are dying for what of emergency care. Britain's much valued NHS appears to have hit a wall. Winter after winter, it has cried crisis as numbers have surged towards capacity. Now everything has obligated against it. Flu is piled on top of COVID. Strikes are piled on care home blockages and labor shortages. Whitehall targets for ambulance waiting times, GP, general practitioner, appointments, and spare bed spaces have taken on the ghostly uncertainty of Chinese pandemic statistics. Crises in health are unlike those in public services such as education and transport. They involve life and death. But given the fastest supply line from 999 calls to A&E admissions to hospital beds to care homes, it is hard to know where the point of finger of cause and effect. The whole system appears to be bursting at the seams. Under Tony Blair, Labour oversaw one of the largest leaks in NHS spending of the post-war years, yet its policies starkly failed to deliver. Since the 2000s, Britain has fallen steadily behind Germany, France, Canada, and even the U.S. in availability of quality medical care. 800 GP practitioners, 800 GP practices have closed in the past 8 years. Several million patients await hospital treatment in England. A third of under 35s are ready to spend their own money going private. NHS disinterestedly is all but extinct. Many point out that other countries in Europe are currently facing similar crises, and that must be borne in mind when reacting today. But either way, the problem remains urgent, and blame is no solution. Policies is little help, but parties have poisoned the NHS before elections and hurled monies at it afterwards. Politicians shout at every other to just spend more. The Health Secretary, Steve Berkley, was even reported to have told the Treasury he would not know what to do with more cash if he got it. Rashad Sukhni and Karen Stemmer both recognize the urgency of NHS reform and improvement, so much so that it may be worth treating this as a war, with a parliamentary coalition for the duration. It is hard to think of anything more factitious than the present weekly shouting match at the dispatch box. The model of a huge centralization public corporation is no longer fit for purpose. It is not used elsewhere in Europe, where health services management is recognized and localized. Britain's layer GPs, hospitals, care homes are rigid and uncoordinated. This occupational democracies are counterelastic. Nothing changes. Slowly the argument for deep reform is taking hold, but it carries a terrible warning. Past attempts such as more centralization, privatization, and charitable statuses have all had their deficits. The NHS is manufacturally too big, and bigness leads to the rule of edges and targets. Niall Bernvald was wrong in dismissing Herbert Morrison's desire for national health to be a local service. Attempts in the 1980s to reduce overall spare bed wait ages are one reason for the present acute bed shortages. Little has been done to reform the care sector. Allowing the privatization of council care homes has been a scandalous waste of money, yet nothing has been done to end it. It is hard not to see the NHS as a model of all that has gone wrong with Britain's public sector. So we are left with today's emergency. Nothing dismisses the support and affections for frontline staff. Like soldiers in wartime, they are workers to whom people inconsistently turn when all seems lost. This makes the decision of nurses to go on strike at such a moment the more unwise. The system has clearly failed nurses. NHS employment must be improved and localized somehow, and all the emergencies should be directed to change it. Outside my local hospital, ambulances pile up, embalmment patients and medical staff. The scene out indoors is of silent desperation. Target is blocked. Beds have run out. People must be suffering, some dying. The, pri- the priority must be emptying the ambulances in somewhere, anywhere, schools, churches, council halls, so that trained volunteers can come to their relief and the ambulances be released into service. Health is a local crisis. Retired doctors and nurses must be pleaded with, summoned, and if necessary, bribed back to work. Private sector hospitals and clinics should be caramaned. If this is like the pandemic of 2020 all over again, then we should treat it as such. And perhaps this time we might learn from our mistakes. Simon Jenkins is a Guardian consultant. Okay. Sounds like the NHS in the UK is really, really bad. Long wait times, lack of nurses and doctors, I heard that I heard that nurses are on strike because they're being paid less. And yeah, I don't live in the UK. I never experienced universal health care. Um, I don't know. If I lived in the UK and I'm sick and I need to see a doctor, I won't be able to because you know there's not a lot of hospital beds. The wait times are really bad, and they are. And the same thing went on in Canada. They have long wait time issues. The wait times are bad. Children, adults, older adults are waiting longer to get care, and some won't be able to see a doctor. So that's why some Canadians are traveling to the U.S. for care. But I'm kind of ignorant of universal health care in other countries. So, I'm probably going to get a dislike on this video, but, I don't care. Um, in the UK, how about, fund the system? The system needs to be funded. Um, Bring in more hospital beds, more doctors, hire more nurses, make improvements on the wait times so they won't be so long. It's like this. I heard that if you don't fund a universal healthcare system, if you don't fund the system, you don't put funding towards a system like the NHS or any other different form or version of universal healthcare, that system's not going to work properly. It's going to lead to a lot of bad things. Like long wait times and labor shortages and being in a very bad crisis. And you know, you know, I heard something about the healthcare system in Canada. I heard that a bunch of premiers like Doug Ford and conservative premiers, conservative politicians, they talk about, you know, Canada's healthcare system, the system, we can't go through the same status quo, long wait times, people waiting longer for care, people getting paid less. That's what I heard. And he talked about, him and the conservative premiers and conservatives in general talked about moving the Canadian healthcare system to an American style healthcare system, this is basically privatization. It's kind of like here in the U.S. Like, if you have a lot of money, you go to the front of the line to get care. And if you don't have the money, then you can't get that same care. So, going to an American style healthcare system for Britain and Canada, that's going to be even worse. I mean, you're going to go through what Americans go through here in the U.S. So I guess, you guys don't want that. In the past, I heard a lot of Canadians coming onto my channel and bashing me on what I was saying because of my ignorance of Canada and the country and the healthcare in general. Saying that, oh, you don't know nothing about our country. You don't live here and all this stuff. Also, I got bashed by a general practitioner, a doctor who works at a hospital somewhere in Canada. So, I'm doing my research. I'm trying my best to learn something about other countries. I'm trying my best. So, and, just excuse my ignorance, okay? I'm just trying to learn about other countries. I think it's a bad idea, for countries like the UK, Canada, and others that have a universal healthcare system. I think it's bad for them to take the American approach, which is not going to help them out greatly. And it's not. It's going to be even worse. I mean, yeah, they complain about, and I see, like here in the UK, how bad it is, how bad the NHS is, and all the problems that it has. And complaining isn't going to help. You got to pressure your politicians to improve the healthcare system. If there's no improvements, you can get rid of, you can vote them out of office, get rid of them if they're not up to the task of tackling the problems within the healthcare system. And also, going back to Canada, Jagmeet Singh, the leader of the NDP, the New Democratic Party, talked about the issues within the Canadian healthcare system. He said that if he was prime minister, he would meet with all the premiers of every province in the territories about the problems within the Canadian healthcare system. Long wait time issues, other bad things. And he said that the liberals and the conservatives aren't addressing the issues. And I look at Jagmeet Singh and I think he should be Prime Minister of Canada. But yeah, looking at that's not going to happen. So, the way I look at it, if Bernie Sanders was President of the United States, Jagmeet Singh is Prime Minister of Canada, and the long forgotten and the ignored Jeremy Corbyn, if he was Prime Minister of the UK, if these countries have leaders have people like Bernie Sanders, Jagmeet Singh, and Jeremy Corbyn running their countries, and these people should be running these countries, I see things getting better. I see America moving to a universal healthcare system. I see Canada and the UK's healthcare system being improved and funded and getting better and having all the issues tackled. I see things getting better, but that's just a thought, and that's not going to happen. So I really feel for the people of the United Kingdom, going through all these problems within the NHS, if they want to get care. 500 people a week are dying because they're unable to get care. They're going through a very terrible winter. Because they won't be able to get any heating because of the war in Ukraine and Russia, and them leaving the European Union through Brexit. The Brexit thing. They wanted this. They made a decision, so they made it, and that's them. Yeah, I really feel for the people of the UK. I just hope things get better for them. Same thing with people in Canada. I just hope things get better for them. And I just hope things get better for people, including myself, here in the U.S. There's a saying, I said this saying, and Winston Wu said this, all countries have problems, but, their problems are not in the extreme as problems here in the U.S. So, I'm not trying to put down the UK, and I'm probably going to get a dislike on this video, but, I don't give a shit, You can correct me and say that what I'm saying in this video is wrong. That's fine, So, I really feel for the doctors and nurses and who work at NHS controlled hospitals in the UK. I also feel for the people who are wanting care. I feel for them, And I think Rasheen Sugnit, he's a conservative PM. He replaced that woman. I forgot what her name was. I don't remember what her name was, but people within Parliament said she was terrible. She barely said anything. She was just a head of lettuce, just sit there, not saying a word. If you're a leader of a country, you should be talking. You shouldn't be sitting back and not saying anything. But, I don't want to get into politics. It's annoying and it's depressing. But, I'm going to say this, hats off to nurses and doctors in hospitals in the UK and Canada and others for their hard work and what they're doing. So, hats off to them. And again, I feel for the people, the regular, normal people of the UK who are wanting care and they're dying and they won't be able to get care because of the long wait times and all the issues within the NHS. The NHS is an old system. It was started back in 1948. It's a good system, but it's an old system and it needs to be improved. It needs to be funded. The wait times need to be improved, and hospital availability needs to be strengthened. So, that's all I got to say in this video. Cheers.